Welcome to the Wispering Podcast.
Our goal is to change the volume on some of life's most difficult conversations.
This podcast is brought to you by Wisp, a hassle-free online service that brings sexual and reproductive health to you with no appointments necessary. Log on to hellowisp.com and in minutes you can request a same-day prescription, order birth control or emergency contraception delivery, and unlock the secret to better orgasms.
Most prescriptions can be picked up at a local pharmacy, or you can have meds shipped in discreet packaging directly to your home. Online consultations only take a few minutes, and all medication is prescribed by U.S. licensed doctors in all 50 states.
Hi guys, welcome back to another Wispering Podcast episode. We have another wonderful guest, but I do want to let you guys know that we are going to be talking about something a little different normally than what me and Dr. Purdy go into. So today we're going to be doing an STD episode, and we're going to be talking about DoxyPEP. But before we get started, I definitely want our guest, Andrea, to introduce herself.
Hello, everyone. Thanks so much for having me on here today. My name's Andrea Sleeth. I am a women's healthcare nurse practitioner with Wisp. I also work as a medical advisor on the company too. So I help to launch products, look at marketing, make sure everything's medically accurate, create a few videos as well. I'm really excited to talk about DoxyPEP today, one of the products that I help launch on the platform.
Awesome. All right. Well, since, we kind of just started off there, do you want to let the people know exactly what is DoxyPEP and, what's the use for it?
Yeah, definitely. So DoxyPEP is a medication called doxycycline. It is an antibiotic. It's used for a variety of things, but for DoxyPEP, what we use it for is for STI prevention. So essentially, it's a 100 milligram tablet that you take 2 of after you've had a potential exposure to a bacterial STI. So when you take this, you should take it within 24 to 72 hours after an unprotected act, and it can reduce your risk of acquiring a bacterial STI like gonorrhea, chlamydia, or syphilis from 62 to 66%, so about 2/3 per the studies.
Okay, awesome. Yeah, because I know I was telling you and Payton earlier that, I've used this before, but I had no clue that, this could be used for STIs as well, because I just use it personally just for, for acne. So is this the same exact thing, just different milligrams, and it can just be used for STIs as well, essentially?
Yeah, definitely. So we also provide this treatment for cyclical acne prevention with birth control. But yeah, essentially for the DoxyPEP, we just use the 200 milligram dosage, and it's just a one-time thing that you use. So yeah, there's tons of different uses for this antibiotic. So it's great.
Okay. So would you say that it's essentially like a morning after pill for STDs?
Yeah, basically, depending on when you have your episode of intercourse, but really it's within the 24 to 72 hour range that you should take it. If you take it after 72 hours, it doesn't show that there's quite as much efficacy at that point. So we're not offering after that time frame. But yeah, within that 72 hour window for sure.
Did you know that most people wait 26 days to see an OBGYN? If you're dealing with a vaginal infection, herpes outbreak, or STI symptoms, you already know that's too long to wait. At hellowisp.com, you can get a prescription in as little as 3 hours. Contact a doctor online and have the care you need delivered discreetly to your home for free in all 50 states, or sent to your local pharmacy for pickup same day.
Okay. So, and I have a friend because when I think about DoxyPEP, I think about PrEP. So is it the same thing as PrEP? And then is this something that people can get for free?
Yeah, so it is different from PrEP. So PrEP is an antiviral that you take daily for the prevention of getting HIV. And it's actually pre-exposure. So it's PrEP for pre-exposure. And it does not prevent against bacterial STIs. Now, DoxyPEP is post-exposure prophylaxis, and you take it within that 72-hour time frame. It does not protect against viruses like the HIV virus or the herpes simplex virus. And it does help for bacterial STIs. Now, it's not free. There is a consultation fee, but it is relatively affordable. Yeah, so it's $22, and that includes your consultation with your medical provider and then also the medication for the treatment as well.
Oh, that's awesome. Okay. So, because I was wondering if it was going to be like, how sometimes Plan B is usually around like $50. So that's really awesome that it's $22 not only for just the medication, but for the consultation as well. Now, everybody is concerned, including myself, when it comes to like risk factors. Like, would you consider this safe?
Yes. So this medication is very safe. As you mentioned, it's used for acne. It's also used for a multitude of other things too, like ear infections, chest infections. It's also used to treat tick-borne illnesses. It's used for the prevention of malaria. So this is a really, really safe medication. And we know it's safe in both patients assigned female at birth and patients assigned male at birth.
Okay. So when it comes to like testing, to my understanding, it's only been tested on people who have been assigned male at birth. So does that mean it would be considered unsafe for people who were not assigned male at birth and essentially female?
Yeah, definitely. And that's a common question that we get asked too. So essentially, there was actually a smaller study done on patients assigned female at birth. It was actually performed in Kenya. There were about 400 women that were enrolled. But unfortunately, there weren't really great results. There were actually no reductions noted in bacterial STIs. But when they look back on the results that they received, some of the things that they questioned are maybe is it anatomical differences? Are there variations in antibiotic resistance in the area where that study was performed? Or was there suboptimal adherence as well? What we do know is that doxycycline concentrations actually peak higher in vaginal secretions compared to rectal, and pharmacological studies also show that the concentrations of doxycycline in the vaginal fluid are enough to provide protection from STIs. So bottom line, it's definitely safe for both genders. More studies do need to be done, but the bottom line is that it's safe and it's a really great treatment option.
Awesome. So okay, so let's talk about the FDA and the CDC. Now, my own personal thing, just because something isn't FDA approved, that to me doesn't take away, the validity of it. That could be scary for a lot of people too. What are your thoughts on that?
Yeah, definitely. So you're right. Exactly. It's not FDA or CDC approved yet, but I will say the CDC does have considerations posted on their platform for this treatment and the reduction in the risk of STIs that it offers. The Department of Public Health in California has actually been utilizing this treatment and has seen similar results of the previous studies that have been done. So a lot of risk reduction in those patient populations. And then some infectious disease clinics are actually prescribing this off-label treatment as well. And if you think about like medications that are used off-label, there's actually several medications. And just because they're used off-label doesn't mean that they're not safe. So spironolactone, if you've heard of that medication before, it's actually utilized for hypertension or heart failure, but it's also used for acne prevention too, because it has anti-androgenic or less testosterone properties in it, which can be really helpful for acne clearing. Amitriptyline is another one that's commonly prescribed for depression, but it's also used to help with patients that have fibromyalgia. Beta blockers like labetalol, if you've heard of that before, that's hypertension medication, but it's commonly prescribed for patients that have performance anxiety. And then another one is misoprostol, which actually is used for the treatment of gastrointestinal ulcers, but it's actually medication that's used in medical abortion and inducing labor in pregnant patients too.
Okay. Now, because I don't know if you kind of broke this down yet already. So how exactly does DoxyPEP work?
Yeah, so essentially what it does when you take this medication after a potential bacterial exposure to an STI, it raises those antibiotic levels, concentrations, and secretions to prevent colonization of the bacteria in your genital tract and your mucous membranes as well.
Okay. So pretty much straight to the point of what we need it to do. Now, when I've taken doxycycline, for my acne, I had to take it with food, and there was one time that I didn't take it, and that was not a fun experience. Granted, it was just really bad nausea. So, are there any I don't want to say severe, but are there any side effects that people should be aware of when it comes to DoxyPEP?
Yeah, I mean, really, you hit the nail on the head.
Oh, okay.
Nausea is a pretty common side effect with most antibiotics. So yeah, taking it with food can definitely help mitigate those symptoms that you can experience with it too. You should
Mhm.
also make sure you drink it with plenty of water because it can cause some irritation to the esophagus, and then you don't want to lay
Right.
down for 30 minutes afterwards because of that risk of the esophagus irritation. And then another really important thing to know too is that it can actually make you more sensitive to the sun. So it's really important
Mhm.
that you wear sunscreen with this particular medication, not only to protect yourself, but also reduce your risk of skin cancer too.
Let's be honest, preventing pregnancy is a pain. Whether you're picking birth control up every month or running to grab Plan B, it costs too much time, money, and effort, all while your partner gets to go about their day uninterrupted. Wisp is changing the game. At hellowisp.com, you can get the reproductive care you need without stepping foot in a doctor's office or waiting in line. Have birth control delivered on your schedule and get emergency contraceptive before you need it.
Okay. Now, can you take DoxyPEP and like an emergency contraception together? Like, can they go hand in hand, or would you need to like kind of choose one or the other, or wait a certain amount of time?
Yeah. So, right. People are concerned about antibiotics decreasing the effectiveness of birth control pills, emergency contraception, things like that too. The good
Mm-hmm.
news is this antibiotic does not reduce the effectiveness of those medications. So certainly if
Okay.
you had an episode of unprotected intercourse, not only are you concerned for STIs, but if you're assigned female at birth, then you could also be concerned for pregnancy as well. So you can certainly take Ella and you can take Plan B at the same time of taking the doxycycline, and it will not reduce your effectiveness. So then you'll have STI, bacterial STI prevention, and then also pregnancy prevention too.
Okay. And then how do you, trying to think. So I'm kind of thinking about like resistance. Does DoxyPEP like increase antibiotic resistance at all?
So anytime you're talking about antibiotics, resistance is
Mm-hmm.
always a potential risk, but it's
Right.
always important to weigh the risks against the benefits. So there's evidence to show that DoxyPEP can decrease the risk of bacterial STIs, especially gonorrhea, which is a very resistant STI already. Because of the benefit that we have with this, there's more benefit to show that taking this can help reduce acquiring these STIs. More studies need to be done to kind of see where we're at with that. And we're going to continue to monitor those studies so we can provide the best and safest patient care.
Okay. And I mean, I love the word DoxyPEP, but I've just realized it's an acronym. So what is the full on phrase? Like break down DoxyPEP so that people kind of know what it actually stands for.
Yeah, definitely. So DoxyPEP stands for doxycycline post-exposure prophylaxis. So
Hmm.
post-exposure after you've had the episode of unprotected intercourse, and prophylaxis, protecting yourself from getting colonized from these bacterial STIs.
Okay. And I want to jump back real quick to the FDA thing. So doxycycline is FDA and CDC approved. It's just DoxyPEP isn't. Is that my
Right.
understanding?
So
Okay.
utilizing that particular treatment in that method is
Hmm.
not CDC or FDA approved. But doxycycline itself is a very safe treatment. It's been around since the 1960s, and it's actually on the World Health Organization essential medications list,
Right.
which are medications that are really helpful in the use of treating various things within a healthcare industry.
Okay. And so the last thing now, okay, so now that we know like people, including myself, have used doxycycline for like acne and things like that, um, would you suggest to someone to not just use their own personal doxycycline prescription to, what's the word I'm looking for? To basically combat any STI prevention, like they would technically need to get this specific type of product or high milligram dosage to do that. Because I don't want anybody thinking like, oh, since I have doxycycline sitting around at home, I can just use that.
For sure. Well, first of all, it's always great to have a clinician to provide you the appropriate education. Really looking at, okay, are you still an appropriate candidate for doxycycline based on your current health history at this time right now? So that's something really important. Secondly, there are recommendations for STI testing too. So after you take DoxyPEP, it's recommended that you get STI screened 3 months afterwards, just to make sure you're not carrying around an asymptomatic STI. And then some people may also need lab work annually too, based on their like medical history that they're experiencing. So essentially, if you have it on hand, you could do that, but it's best to get it from a trusted healthcare provider so you can get the appropriate education. You're on their radar so they can provide you with appropriate STI testing when needed. And if you happen to get STI symptoms, so if you're having irregular discharge, itching, anything abnormal, you can reach out to your healthcare provider. They already know they've provided you with DoxyPEP, so then they can promptly provide you with STI screening so you can get treatment right away too.
Do you know the medical term for someone who experiences herpes, cold sores, chronic UTIs, yeast infections, or BV? It's called being human. At hellowisp.com, you can get the sexual health care you need same day without stepping foot in a doctor's office. Privately message a doctor online and get same-day prescriptions for BV, yeast, UTIs, STIs, herpes, cold sores, birth control, and emergency contraceptive. Delivered discreetly to your home for free in all 50 states, or sent directly to your local pharmacy within 3 hours.
Okay, cool. Now, does Wisp, do our physicians, are they able to order labs for people to get any screenings done?
Definitely. So we do have STD screening available on our platform right now. We are expanding our screening to test for all anatomical sites that may be exposed to bacterial STIs. And right now in our pilot, we're just offering it on an exposure basis, but that may be evolving on our platform. But it's really important that we follow the recommendations and the guidelines so we can ensure that we're providing the best quality care for our patients.
Oh, this is awesome. Okay. I'll tell you, every time I get on these episodes, I learn something new. This is awesome. And I'm glad that, I at least have some form of like familiarity with doxycycline, just like on a personal aspect, and that it can do more than just what I thought it had a sole purpose for. So this was awesome. So thank you so much. This was top tier. Is there anything else that you kind of wanted to leave behind concerning DoxyPEP for anyone? Or just even about yourself in general. Because how long have you been working with Wisp in this specific aspect?
Yeah, so I actually started working for Wisp a year ago as a nurse practitioner providing care to our patients. But at the beginning of the year, I started shifting into a role more of medical advising with looking over our marketing materials, making sure we're providing the best up-to-date facts with not only statistics, but patient-facing information, and then making sure that we're providing care that aligns with CDC recommendations and guidelines, and just also providing the best care too. So it's been really great to be able to do this. One of my favorite things is patient education. So I always really like the opportunity to clear up any misinformation, because when it comes to sexual health care, there is a lot of misinformation. So that's why this podcast, Wisp Social, and your healthcare provider can always help clear up any misinformation or provide additional education.
Awesome. Well, thank you so much again for joining us. This has been amazing. And again, thank you everyone who's listening in right now. We will be back together again on a next episode for Estradiol, and I'm excited to talk about that with you. And of course, guys, if you want to send in any patient stories, we have a phone number you can call in either anonymously or not. It's totally fine. The number again is 415-520-8215, or you can email Payton, Payton, at hellowisp.com for any written submissions. And of course, we love to reward you guys for just listening in. You can always get 15% off with the code Wispering15. You'll just remove the H out of Whispering. And until next time, thank you so much again for joining us today.
Thank you so much.
All right, guys, we'll talk to you soon on the next episode.